Good afternoon, everyone. This is Steve Wilson from the State Water Survey at the U of I, and today our webinar is What Environmental Health Professionals Need to Know About Wells. Thanks for joining us. I want to mention that the private well class program that we manage is funded through the Rural Community Systems Partnership and US EPA. RCAP, I'll mention more about them in a minute, is our partner on this program. They also are the boots on the ground end of our efforts, and I'll talk a lot about that today. If you don't know the RCAP person in your region, in your area, in your state, you probably should if you are a professional working with private well owners, and we can help you with that. Okay, so as I mentioned, this webinar is part of a national program being implemented by RCAP, and these materials do follow our private well owner course, but they are not the class itself. There's a 10-lesson class you can sign up for at privatewellclass.org. And from many past webinars, we've learned that most EHPs especially have not taken the 10-lesson class. They've just attended the webinars. And a lot of folks feel like or assume our webinars are our class, but there's a much more detailed class that has 10 lessons. It walks you through everything from groundwater basics to treatment, and a lot more than we could cover in an hour-and-a-half long webinar. We are recording the webinar today, and it will be available on both our website and on YouTube. I'll tell you now, the advantage to watching any of the recordings on YouTube is you can see them full screen, and the way it's set up on our website, you have to watch it just in the window that's there. So, but you can get to the YouTube page for private well class simply by going down to the bottom of the main page, and you'll see the YouTube link there. Many of you asked questions today, and we'll get to a number of those. Obviously, there's over 400 people who registered, and so we won't get to all of them. But if during the presentation today or during the question and answer session at the end, you have other questions, please put them in the chat box or the question box you have on your GoToWebinar window. Katie Buckley, who's with me today, will be monitoring that, and we'll stick around at the end to go through those as well. As long as you ask questions, we'll try to stay here and answer them. Yeah, so as far as credentials go, if you're on this webinar as either an Illinois LHP credit person or looking for NEHA credit, at least on the NEHA side, your credentialing cycle is 2 years long. And so this webinar has been delivered those 4 times in the last 2 years that are listed in the bottom right. You can't get credit for it more than once during your credentialing cycle. And so the example I provided here is if your credentialing cycle just started 9/1/21 and you take this today, you can't take the same webinar again until after 9/1/23. And so be wary of that. There is a handout tab on the GoToWebinar window. There are 3 handouts in there, including the certificate of completion for NEHA, the agenda, and a worksheet. The email address listed here, info@privatewellclass.org. Please email us there if you need a copy of the slide deck or other information, as well as the forms for getting your CEUs. That's all handled through that email address. And be patient with us. We're a small staff. Sometimes with this many folks, if we have a lot of requests, it might take a little time. It's kind of an addition to our quote day jobs. So RCAP, I mentioned RCAP. They're actually known by a lot of different names because there's 6 regional nonprofits that work together with the national office to, that's why they're called a partnership. RCAC is the Western RCAP, Midwest Assistance Program is in the Upper Midwest, as well as Great Lakes Community Action Partnership, which Illinois is a part of, which I am in. And then you can see the others are RCAP Solutions, SURCAP, which stands for Southeast Rural Community Action Partnership, and Communities Unlimited. Figure out which of these regions is the RCAP regional affiliate for your state. That's who you want to contact. I'll mention further on in the program some of the opportunities they provide, especially as a partner to you. If you're trying to get a private well program off the ground, or you need expertise for a presentation, or you have a problem well that you need help figuring out what to do with. They're doing assessments of private wells as part of our EPA funding, and they've done a lot of them around the country. And there's no better way to learn about wells than to actually go visit wells as part of your job, and that's what those folks are doing. The water survey where we're at, even people in Illinois don't know who we are. It's kind of funny. We've been around since 1895, so this is our 126th anniversary this year. We were started by the state legislature in Illinois because of cholera and typhoid outbreaks. And this placard is up near Noyes Lab at the University of Illinois, which is our chemistry department. But the water survey is just like a state geological survey, if you're familiar with your state geological survey, except most of our focus is on water. So we have an atmospheric sciences section, surface water hydrology and groundwater hydrology groups, as well as we do floodplain mapping, and we have a lab that does chemistry and supports our research when we do like sampling private wells. They provide sampling services for that. And so I bring that up because we also have a state mandate, even though we're not a state agency anymore. We were for many years. We house the state's well logs, and we also monitor water use in the state through the Illinois Water Use Act. And the survey, as I mentioned, has been around for a long time. This is in 1918. This is a water survey field vehicle in Oakland, Illinois. So I'm in charge of all of our data and information services here. And so one of the things we're doing now is going through our records, which date back to 1895. And many of you, if you've been on these webinars before, you've seen me show a typhoid map of Pana, Illinois in 1916. Well, I switched those out for something new. This is us testing a hand pump at a park in a community. Again, this is in the 19-teens. You can see the tin cup laying on the ground there just in front of the hand pump, and the water surveys field equipment in those canisters or boxes there for collecting a water sample. Pretty interesting stuff. I mentioned we house the state's well logs. So if you remember back in the 30s, right after the Depression, which hopefully none of you do remember, or most of us don't remember, but if you remember that story, there was a conservation corps. I think it was called Community Conservation Corps. I'm not 100% sure. It was meant as a way to get Americans back on their feet. So the federal government gave out, provided tens of thousands of jobs, and every state kind of used those folks to do different things. I know in Indiana, they helped build state parks. And in Illinois, they inventoried private wells. So this is in Schuyler County near Rushville. And this is interesting for a couple of reasons. One, you can see what I've circled here. It says about 60 years ago is when this well was dug. But right below that, it says depth equals 135 feet, hand dug. 135-foot hand dug well, if you can imagine. And so, and the water level was 60 feet. So scrolling down this page, the date is March 9th, 1934. So 60 years before that would have been in the 1870s. And the person who did this, which was Arthur Thompson, was the person who went out and was doing the wells in Schuyler County. So this is the deepest hand dug well so far I've encountered. I would stand to say it may be one of the deepest hand dug wells ever dug. And I forgot to show on here, back up at the top, they said at the bottom, that's 2 buckets and a chain. This had a pump in it, and it was taken out because they preferred to get their water through the bucket with a chain. And that's where we were back in those days. One other one here, this said this is a spring. They had a well, and they couldn't get water. And so if I won't read all of this, but the folks he talked to said, oh, we get our water from a spring that's just up about a quarter mile away. He went up there. The owner came out and saw him. He was also bringing water bottles with him. It's their water source whenever there's any kind of drought or it gets dry. Their wells go dry, but the spring always runs. And so this is still, you know, folks today swear by springs, even though they're super contaminated in almost every case. You can't convince people that their springs where they go get their water is full of, E. coli, coliform, giardia, a bunch of other things. And there's plenty of evidence to show that none of those are safe as a drinking water supply. So moving on, sorry, the Water Survey is a pretty interesting organization. So we're pretty proud to work here. So I'm a groundwater hydrologist at the survey, and Katie is our water resources outreach specialist who works on the private well program. And so again, if you have questions, she'll be fielding those during the webinar in the question or chat box that you have on your GoToWebinar screen. So today what I want to talk about, as environmental health professionals and as a groundwater hydrologist, we face many of the same challenges related to private wells, and as well as issues with well owners and well owner attitudes, like the folks that still want to drink from a spring even though it's contaminated. So I'm going to go over those things as well as some basics on groundwater and wells. And then what I really want to talk about is the gap between groundwater and health professionals. And what I've learned in running this program for the last 10 years or so, and my 30 years here at the survey, is that there's really, it's important that we both lean on each other for solving problems. And so at the end, I'll talk about the private well class and some of those things, because I'm not going to do a poll today, but I imagine if I asked, typically is through the, at least for EHPs, only between 10 and 20% of the folks on our webinars have actually taken our class. So the issues are really about public health protection and source water protection and just general water quality. Those encompass everything that we're worried about. It's about public health, it's about protecting our groundwater sources, and making sure that we have water quality that is fit to drink and is potable. There are a lot of issues that are in the news, droughts, floods, just general contamination issues when something happens. You can go back in time and look through the media and see, the flooding from confinement hog facilities in the late 80s to lead at Flint in 2014 and 13 to, now there's a term non-regulated drinking water that's given to private wells because in most cases they aren't regulated after installation. Even things like boil orders. And we find that well owners will call us or a small community water operator whenever a boil order has been issued in the local paper, not understanding that a boil order is for their public water supply or community water supply because of a main break. And so the water's not being properly, or things can get into the water line, and it has nothing to do with their aquifer or their private well. And so there's a lot of things we need to educate folks about. And when these things happen, when they get in the news, it's our opportunity to really do education and outreach and convince folks of why it's important that they understand their well and be a good steward of their well and water quality. So the challenges we face are many. Public water supplies or community water supplies fall under the Safe Drinking Water Act, which is a national legislation that passed in 1972 that requires communities to meet certain standards for health, and most states now have well construction code. There's actually a few that don't, but even how they define things when it goes state by state differs, like the definition of what's a private well, permitting versus well log submittal. In some states, that's very well funded, and whatever state agency is monitoring that does a great job. In some states, it's very poorly funded, and they just don't have the staff or the resources to really do their diligence as far as making sure all the drillers are filing their logs and some things like that. And then you have differences. I mentioned New Jersey and Pennsylvania. New Jersey passed a law 15 to 20 years ago that requires water testing by the state lab for any property sale that involves a private well. So they get about 13,000 research quality samples every year of their private wells just from sales of homes. And that gives them, as me as a researcher, I look at that and, it'd be great to have now, over 200,000 samples that you have assurance were done properly, that can evaluate your aquifer quality, where there are hot spots, where there are issues, all those things. versus Pennsylvania, which I pick on Pennsylvania mainly because their state legislature hasn't passed any rules related to private wells. So not only do they not have well construction guidelines, which means anyone can use any kind of material, any depth, any kind of pipe. There are just no rules to put in a well. To the fact that I mentioned that they don't license well drillers, and someone contacted me and said, "Oh, yes, we do." And so I'll show you that in a minute. But they really don't. I can go send in my $60 and become a licensed well driller in Pennsylvania with no experience, no test to pass, no continuing education, any of those things. And that gets to, I mentioned some states have more resources than others, and that really affects how the rules are enforced. So, and also we found in a lot of county health departments, wells are not the highest priority in some places, or they just don't have staff who are adequately trained on private well issues. I know when we started the private well class, over 20% of the initial 1,000 people that took our class were sanitarians or environmental health professionals. And they said two things: why wasn't this available when I started my job? And how do I get credit for this? Which is why now we offer credit for that. And so what that leads to really is a very unorganized local approach to support in most parts in the country, or And so either a local health district or a county health department may have a person there who's really interested and cares about private well issues. They may start a program, they may really be active in it, and then they retire or they move on to another job, and there may not be another person there, and all of a sudden that program just stalls or just basically goes away. And so that's the problems and some of the challenges we face. Going back to Pennsylvania, I just want to highlight here, a license does not imply that a driller has knowledge of proper drilling or well construction practice. In Pennsylvania, there are no statewide construction or siting standards for private water wells. So, and actually it says some municipalities do have standards. Some local jurisdictions have actually created their own rules where they maybe require, instead of a state license, you're required to have a certification from NGWA, the National Groundwater Association, which is listed there in the middle. And so it's basically the homeowner's responsibility, and that's a theme throughout a lot of the work we do. It's up to the well owner to understand their risks so they know they should test, and they're protecting their family's health, and many do not. So the biggest issues, though, that I've found, and again, I've been here for over 30 years, and I work with private well owners in Illinois all the time, always have. It's really poor well construction is one of the biggest issues, as well as lack of well owner knowledge and education. We get questions that are basic about their water supply. We have community water supply operators tell us they get calls from private well owners who are complaining because they don't have any water, not understanding that they have a private well. Those things really happen. And it's certainly not every well owner, but there's a lot who don't understand their responsibility and just assume that they're safe. And so they don't test, they don't maintain their systems, they don't ensure that they're not providing sources of contamination near their well. And that's all on us to try to change that. The poor well construction, every state that does have rules have always grandfathered in past wells, which is why we see a lot of still hand dug wells that are in existence. I grew up on one. It was only 14 feet deep. It was contaminated the entire time I was growing up. We just didn't realize it. So the other problem we have is well owners come from every walk of life, every social, economic, and education class. Some have been on a well their entire life, and because their families lived longer or no one's really gotten sick that they know of from it, they accept it. And others may be brand new and not understand any of the responsibilities related to wells. So it can also be in a very rural area where I grew up, or in a completely urban setting like Cook County, which Cook County is Chicago proper mostly, and some of the near suburbs. But there are 3,000 private wells in Cook County, which most people in Illinois are really surprised by. But that's because there are areas that are not incorporated between city boundaries and things like that, where they still have septic and private wells. And so, their risks are much different than where I grew up. They have urban issues. There might be a gas station on the corner not too far from them, where in my area it was basically livestock or septic that were going to be the culprit, or use of pesticides or other chemicals. So on that topic, Barb Luukkonen from the University of Minnesota Extension, who's been retired now for almost 10 years, her and two other folks did this study where they sent out 2,690 surveys in total. And some they put in a $2 bill, some they put in a coupon for a free water test, and some they put in both. You can see on the first box there, or the first table, they had about 64% return these sample results, which is really interesting. But of those folks, 87% said they were only slightly or not worried, even though well over, I want to say it was about 1,300 hadn't ever tested. So even though most people hadn't tested, they believe their water's safe. And they asked them to say what reasons why. So there was a laundry list, a lot more than 10, and they could check as many boxes as they wanted to. But you can see we've been drinking it for years. We didn't know what to test for. My favorite one is I don't want to know. And that actually happened to me. I tell that story all the time. We were sampling for arsenic in a rural subdivision with private wells. And one of the homeowners said, you can sample my well if you don't send me results and you do it and I'm not home, from an outside tap. And I asked why. Well, in Illinois, there's a form you fill out when you're selling your home that's legally binding. And one of the questions is, do you know of any adverse issues with your well or septic? He wanted to be able to honestly answer that question, no. And so he did not want to know. And we run into that once in a while now, and it's really a shame, because that's certainly the opposite of what we would want a person selling or buying their home to do. So again, they're either, the people who hadn't tested, there's 1,100, I guess. But there's either issues with they don't know what to test for. These are on us, didn't know I should test. That's education and outreach, and we need to get that message out. And again, they're hard to reach. Versus not really understanding that what the risk really is. It's probably fine. I don't want to know. We've been drinking it for years. So there's a number of issues there, and there's many reasons why they're hard to reach. Somewhat nothing to do with even county or local health departments. And 99% of the health departments around the country, local ones, either county or just local, they have no authority to condemn a well, but a lot of people believe they do. And so they won't go to their health department because of that. And that's a shame, because the health departments are there to help them understand why it's a risk. We sampled some wells for arsenic in Illinois and found levels well into the 200s. And I encouraged this family that had 7 kids that they needed to contact their local health department, and they weren't going to do it. And I explained they cannot tell you not to drink your water. They're going to seriously recommend you shouldn't, or that you need to add treatment, but they can't make you stop drinking your water. Whether that's right or wrong, that's the way it is. But there's a lot of other reasons. They don't, again, not trusting the government, just a lack of understanding. My dad always believed our well water was safe, and it was actually better than city water because it didn't have chemicals in it. Cities put chlorine and other things in their water, not understanding those issues. So we're going to talk a little about aquifers and wells, just kind of a basic 101. There's really, as far as aquifer availability, that's going to determine what type of well you might have. So we see old dug or bored wells. Those are typically in areas where there's no, quote, real aquifer. Or in the case like, the well I grew up on, my grandpa hand dug in 1933. Even though if he'd have went 70 feet down, we'd hit a sand and gravel aquifer there. But otherwise, wells are either in sand and gravel or they're in bedrock, consolidated rock. And so, in some areas, like especially in the upper portions of the country where there's been glaciation, you may have more than one choice. Where I'm at here in Champaign County, we have 2 sand and gravel aquifers, and then there's bedrock below that has some potable water. And so, but if you have a good water supply at 70 feet, most of the time you're not going to drill down to 200 or 300 to hit a different water supply unless there's a water quality issue you already know of. And so it's really important to understand the differences there, especially with dug and bored wells, because many of those are getting water from the water table and from shallow infiltration, and those tend to be most at risk. We actually did a study in the 90s looking at dug and bored wells versus drilled wells of different depths for, it's called the pesticide pilot study, and by far dug and bored wells were the most contaminated. And that's just because they're getting their water from the surface or near the surface, where there's more likely to be infiltration of some contaminant. So dug and bored wells, what are they? You can see this driller here. If you look below their feet, you'll see there's a 3-foot hole in the ground, and that bucket rig is taking out 3 or 4 feet of dirt at a time. And in the end, you put concrete casing vertically there. That's tile like under a road, and then water seeps in between there. I always find this a fascinating photo because to me that looks like a bean field, and why you'd put your well that's going to get shallow groundwater out where you're putting pesticides. And this probably isn't beans all the time. It's also in corn some years, so you're adding fertilizer and everything else. Really boggles me, but maybe that's the only place they had. And so these are all dug or bored wells. 2 are obvious, the hand dug one with the tin and all those things in the upper left, and on the right, the one that's got the concrete tile with the concrete lid. You have to use a large pipe wrench, or not a pipe wrench, but a pipe bar a breaker bar to get that off. It's so heavy. And then there's also construction where at the surface it looks like a drilled well, and then 10 feet down or so, it spreads into the 3 or 4 foot diameter bored well. And here's what those look like, at least the 2 that are bored. The one on the left has the concrete tile on top, and you can see most of the water is coming in. There's sand lenses in this, but it's mostly fine textured soil. But there's no aquifer here, and so you put in a large diameter well because it stores water. In that sense, it's like a cistern. You're storing a volume of water that's enough that when you use it, it'll go down, but then during the day or during the night when no one's using water, it fills back in slowly from the surrounding material. And the one on the right is the construction that looks like a drilled well on top because it's a small diameter, and they're showing this as a 4-inch diameter casing with a pitless, and then the concrete lid is down at 10 feet or more. And so then you've cut a little of the volume out, but typically you do that when the water table's deeper, and this well may go down 30, 40 feet under the water table. And water seeping in where those concrete tile fit together, they're not sealed. It's just there's a male thread and a female thread, and water can seep in on each of those 4-foot sections. The problem though, if this is not like the example on the left shows concrete around the upper 10 feet, that isn't always the case, and it wasn't always done. And so water can seep in at that first seam, which is only 2 or 3 feet below land surface. Versus a sand and gravel well. So as they're called, sand and gravel wells get their water from a sand and gravel aquifer, which are large, usually either glacially deposited or alluvial, which means it's from a river. Close to the current river, or even in any bottom ground. The example I tell people in Illinois is about 10 miles out of St. Louis, as you're going south, you go off this large hill down to the bottoms along the Mississippi. And the Mississippi bottomland is about 14 miles wide there. Well, when the glaciers were melting, several 100,000 years ago, that was the river. It was 14 miles wide. And so all the sand that was deposited, like you'd see it on a sandbar today for a small river, is what is now a water supply, and it's buried. And so the screen that's shown here, a well screen, the way a typical sand and gravel well is drilled is a solid pipe until 5 to 10 feet from the bottom, and then you put in a screen. And the screen is sized based on the size of the sand grains. And so these can be really tightly woven if it's small sand grains, or less tightly woven if they're larger sand grains or gravel. And the idea of a well screen is to let the water in and keep the sand out. You also use a gravel pack that's sized based on the formation sand size, so that it acts as a filter as well to keep the fines from getting in the well. The important thing about a sand and gravel well is if you know the depth, you know where the water is coming from. It's coming typically in a private well from the bottom 4 or 5 feet in general. So if it's a 200-foot sand and gravel well, the water's coming in 195 to 200 feet below land surface. The rest of the well is solid casing, and water can't get into it there. And if it's properly grouted, it can't come in along the annulus. So here's just one sand and gravel log. These are Illinois logs I'm going to show you, but there's a lot of information here. It tells you where the water's coming from. It shows that there's a red jacket pump that's capacity of 10 gallons per minute. They pumped it. Number 17 is the one I really wanted to show you, because this is sand and gravel from 4 feet down to 45 feet. So this is where this is like in a bottom area along a large river. So it's sand throughout, which means this well is also susceptible to contamination because the 4 feet of topsoil is probably sandy as well. There's no clay above it or any of those things, and so the geology matters. But it's such a good producing well that the static level is 3 feet below the casing, and when they pumped it at 50 gallons a minute for 3 hours, it was still at 3 feet below the casing. So there's so much water available in the sand and gravel aquifer because sand is very porous. So the porosity is around 30%, which means for every 100 feet of sand you have, 30 feet of that is water. That's a lot of water. And the grains are large enough that water can flow through it very easily, so it can fill in the well once you start pumping. And all of that's to say that a bedrock well is much different. So when you drill a bedrock well, which this example shows, you only put casing in to 10 or 20 feet into the bedrock in general. That's how they're put in. And so you seat the casing in the rock, and then you keep drilling, and the rest of the hole is open hole. That's because you don't get water from bedrock. You get water from the fractures in the rock. So you have to have an open hole that you're drilling, and the rock formation itself acts as the casing because you're hoping to hit fractures. That's the only way you'll get water in your well. And so what that means is you can't go by well depth to understand what kind of risks you have at this well. So this could be, this shows 10 to 20 feet into rock, and if you use the scale there, so it's probably 40 or 50 feet of casing, and then the well goes on down below that. But we see older wells that may only have 20 feet of casing because bedrock's at surface, at the land surface. I went out to upstate New York a few years ago and was working with some folks out there on their water quality issues, and many of the wells, the bedrock is the aquifer, and it's right at the surface. So any fractures in the rock that come up to the surface are a conduit for material to go into the aquifer. And so we saw septic tanks sitting on top of the bedrock, all other kinds of things. And so when a bunch of sampling was done, many of the wells were contaminated with E. coli and coliform. And it's because they're getting their water from a unit that's not safe itself. So when bedrock's at the surface, depending on the number of fractures, where they run, if they run up to the surface, it can be a direct conduit, almost like karst is, into the aquifer. And so it really matters how much casing there is. For instance, in New York, there are a number of wells that were 300 or 400 feet deep. So you'd think, oh, well, my well's pretty deep, not going to be an issue. But they only have 15 to 20 feet of casing, which means water can get in that well from anywhere from 20 feet down to 300, which is great for the amount of water that might come in, but at 20 feet isn't enough protection in almost every case to prevent surface infiltration from eventually getting in to that unit and possibly into the well. Many states now have changed their well codes and require at least 50 feet of casing, and that varies by state. You'd have to look at your state rules. But we just ran across a case in South Carolina where someone contacted us, and we're trying to find out for sure, but it looks like they only put in 20 feet of casing, which may be why he keeps having bacteria problems in his well. Okay, so and this is an example to back all that up. You can see here, if you look down at number 18 on the bottom right, there is some gravel. There was 4 feet of gravel, but it was brown and red, which means it's dry and been oxidized. So it's if you find clay that's not dark or gray, it means it's not wet. And so that's one telltale that you wouldn't want to put a well into this 4 feet of sand, because likely it goes dry at least some of the year. And so when you get down to limestone at 189 feet, and then they hit shale, which is like cemented clay, so water doesn't move through it. It's an aquitard or an aquiclude, not an aquifer. They stopped. And so the water's actually coming here from this limestone. And if you look up at number 15, they used 5-inch PVC down to 179, so they're still in the unconsolidated material in the sand and the broken limestone, or I guess still in the sand and clay. And then they put 20 feet of black steel casing 10 feet into rock. So they hit rock at 189, they put the steel in down to 199. So they seed it in the rock there, and they use steel because PVC, when you're trying to make a tight seal, you could break it or crack it if you torque it too much, versus the steel is going to be fine. So in this well, water can get in anywhere from 199 feet on down. Further up on number 12, I just want to make a note that the person who filled this out, since it's typed, was probably not the driller, but someone in their office. And they are used to looking at this geology and taking the bottom unit and assuming that's where the well's finished and that's where the water's coming from. So they put water from shale from 257 to 260. That is not true. It's coming from the limestone. And so there's a mistake on this one. It's a good example to show that. But there's a lot of information on a well log, and obviously it's really important to be able to come across those. And unfortunately, not every state requires those still. Most do. But a number of states didn't pass laws to require that until as late as 2000. So any wells put in before 2000 in some states, you're not going to find information. In many states, other states, it was in the 80s. In Illinois, it was in 1968. And so here's a 1980 log that has all this information. We've been fortunate that through our IDPH, we have a really strong program. Our drillers are all on board. You know, they have to maintain CEUs. It's a partnership, and they seem to work well together. So what to do with these wells? Well, our advice would be well construction codes continually change, just like the dug well or the bored well code. It was probably 15 or 20 years ago when they added a best practice to use just 4 6-inch pipe for the upper 10 feet in our code. And so, but because all these existing wells were grandfathered in, we still see wells in pits, and we still see hand dug wells that aren't protective at the surface. And so they're not only an opportunity for surface contamination to get in a well, but like especially in the case of a pit, they're a safety hazard. And if you're not familiar with a dug well pit, before the 60s, when the pitless adapter was developed, in cold climates where you have a frost line in the winter, wells were put 3 or 4 feet down into a pit so that they wouldn't freeze in the winter, the pipes wouldn't freeze, because you ran the pipe out of the top and turned it, elbowed it into the home. And a pitless adapter allows you to run the pipe all the way up to the surface, and you can still pull the pump with a pitless, and it does that same function. So here's some examples. I showed you the picture on the bottom before. We sampled this well as part of a dug and bored well study back in the 90s. The other two, well, the one on the upper left is from the Washington State Department of Ecology. They're the agency in Washington State that regulates well drillers and well construction. And they had a blog. I'm not sure if it's still up, but this blog post was about this old corrugated steel well. You can see it's in a well house, but that plywood broke. The person who lived there fell to her death. But if you look at the building and what's inside here, there's an old funnel there, probably for oil. It looks like insulation that's rotted and is along the sides. It's just not a safe way to have your well. What's fallen in there even before, you know, and what can fall in there, like mice and all those things. And this picture on the upper right is really for dramatic effect. This is, you can see the bricks down at the bottom, but that's a dead goat. And this is a well in a rural area in southern Illinois. Don Kelderman was down in that area researching his family genealogy, and I ran across him when I was down there. And he showed me this picture, and you know, it's exactly what can happen. This well was not covered on the top. It actually was not in use anymore, but it's from an old farmstead, and you can see the old brick or stones down there where they had actually dug out the well to begin with. But it's this is an extreme example, but it's not the only one, and it's not by far. There's probably worse that have happened to wells that people are actually drinking out of. So what do you do with these? You should try to bring them up to code. And so what we tell well owners is, if you have a well in a pit, extend that to the surface, get a pitless and put in there if you need to, and then fill all that in with clay and grout. And talk to, you can talk to your contractor, your county health, well authority, even extension. They've got information that'll help a well owner find the best approach if you're not versed in those things. The Midwest Plan Service out of Iowa State, they have a book. It's MWPS 14, which has a ton of information that's reflected mainly for farms, but about pumps and wells and all the things you need to know about how all that stuff works. So the other problem is abandoned wells. We know since logs weren't required until at least the 60s, and in many states later, there are probably more undocumented wells that are still out there than there are wells that we know of. And I know that's the case in Illinois. We estimate there's between 750 and 800,000 wells in use. We house the state's well logs, and we have about 450 well logs in our files. And so that's wells in use, not alone wells that are no longer being used and abandoned. And so it's just a conduit to provide a source of contamination. If you have, we tell well owners, if you have an abandoned well on your property, you need to get it fixed and properly seal it, because if someone trespasses on your property and falls in a well and gets hurt or gets killed, or you contaminate an aquifer, you're going to be liable. And it's really not worth the risk for the expense it is to seal an abandoned well. Here's some more examples for abandoned wells. Again, the two pictures are both from the Washington State Department of Ecology's blog. These both happen in Washington State. The Sheldon man walked away from this, which is very lucky to fall 45 feet into an old well that's in your backyard that you didn't even know was there, and walk away. And so the fact that he was found and it wasn't full of water and a lot of things made him a lucky man that day. But we see livestock getting these things all the time. And the newspaper clippings over here, three are from Illinois, and one is Jessica McClure, the little girl that fell into a well in Texas, and I think it was in the 90s, and it was covered live on CNN for like 24 hours while they tried to dig her out. Those of you old enough to remember that, now she's married and a mother of 3, I believe. So it happens more than people realize. So as far as the groundwater and health gaps, the bottom line is groundwater is complicated, and I'll show you an example. There can be multiple aquifers in one place, and on the health side, you look at someone with a private well, and if you want to do a study, say in a local area, of looking at their water quality and compare their health issues, most of the time you're not looking to see if even their water's coming from the same place, or are they actually drinking the water. All those things are things you have to know in order to be able to compare apples to apples. And so they're not community water supply issues. And I mentioned Johns Hopkins here because they put out a thing. I was invited to a meeting, and they listed all these issues for private wells, and one of them they listed was algal blooms. Well, they had taken the information from EPA's webpage for community water supplies, which includes surface water supplies, and listed algal blooms as a big concern, which they are. But you don't have algal blooms in private wells. And so you have to understand private well issues and groundwater issues to really understand what you are dealing with and what you're not. And there's an issue, I know in one of our other webinars we described this in detail, but there's a difference between a groundwater sample and a drinking water sample. If you collect our lab asks people to collect 2, one from an outside spigot that's before any kind of treatment or premise plumbing, and to let it run, so that we know the pump's kicked on in the well and it's actually groundwater that's being collected there, versus at your kitchen tap where it's ran through a softener, a filter, maybe an RO unit, or some other device, as well as your premise plumbing that might be lead or copper or galvanized, and that changes the water chemistry. And so we see very different results between a groundwater sample and a drinking water sample. And to really understand people's issues at their home, it's best to have both, because you can see what their source water quality was and then what's going on in the house that may change that. And so I say no information on treatment or bottled water use. A lot of times, whenever for a health study, you're looking at an area and you want to consider whether it's private wells or not, you're assuming everybody's drinking water from the same aquifer and it's the same water. You don't know if they're even drinking it, for one. We have a lot of well owners tell us they don't drink their water, but they use it for bathing and showering or whatever. Or they may have added treatment and have an RO unit, and that's where their drinking water is coming from. If they've got an RO unit, there's not much left in their water that can be causing them any health effects. And so there's a lot of complications, and that's my point. And on our side, on my side, as a groundwater hydrologist, I've been fortunate enough to work with a lot of environmental health professionals over the last, especially 8 or 10 years, and I've learned a lot from them. And so that's, I don't make this recommendation lightly. We look at things differently, and we've been trained differently, even in college. And so looking at each other's viewpoint, you learn a lot more about the holistic issue we're trying to deal with. And when you have a group that says, no, they're not health professionals, or they're not, they don't know groundwater, so we're not going to work with them, you're really limiting what you can accomplish. And that's the bottom line. And I said lagoon example here. So we put together an assessment tool with a group of experts. And I think 11 people from around the country who are all private well experts. And I kind of convened the group, but I in no way was the authority there. There are a lot of people a lot smarter than I am about private wells. And in case in point, one of the folks from Nebraska brought up that, well, what about lagoons as a type of septic system? I'm like, you can't have a lagoon as a septic system. Well, yes, you can. And that's actually, it depends on the state, but at least Oklahoma, Nebraska, Illinois, and a few others that they mentioned allow lagoons for your private septic system. And so that's, I learned something that day. And I learned something many days when working with folks from different parts of the country, especially. And so my point is, we all need to be involved in these efforts in order to ensure that we aren't missing something. And I even see research papers in journals where some of those things haven't been evaluated correctly. And that's because all the reviewers are also from the same field. And if they would just have someone from a different lens take a look, they might realize that there's some things that they could have done differently, or they could have explained differently, or whatever. So complicated aquifer. So this is the Mudhammad Aquifer and on the bottom here where the A is. It's a large sand and gravel aquifer that exists in central Illinois. It's actually where the water for Champaign-Urbana, where I live, comes from. It covers about 120 miles of length from the state line near Indiana west to the Illinois River. It's as much as 250 feet thick in places, and it's as wide as 14 miles in places. It's an old river bottom that before there were any glaciers, it was a natural cut river into bedrock, very similar to the Grand Canyon today and how that was cut. It's just there hasn't been glaciation to fill the Grand Canyon in. So it's got low points. It's got a center of the river bottom, if you will, the lowest point. It's got hills on the sides, and it's been filled with material from 3 glaciations. And if you look over at on the left under time units, the third bar in says pre-Illinois episode, and Wisconsin episode. Those are the 3 glaciations that have occurred in Illinois. Each one, whenever the glacier started melting, deposited the largest material first, then finer and finer material as the water receded and the velocity slowed. Then a land surface formed. That's what the little squiggly lines are. That's where there's soil units, and so those are organic. That's where methane comes from, decaying plant and animal material. When another glacier came along, it covered all that up. So in this particular figure, there are places you could drill and hit 5 or 6 different sand units, and all could have different chemistry. And so you have to understand the geology in order to understand how you can attribute health effects, as well as what risks they may have. Some of the Mudhammad has natural occurring arsenic, some other parts of it do not, and it's because of the source grains and where they came from. So it's all really a lot to take in and to understand. So what's the best thing to do? It's develop a relationship with your scientific surveys. You know, in Illinois, we have a water survey. Most states do not. So it's your state geological survey or USGS, as well as your resource agencies like DNR, DEQ, DHHS. You know, it depends on what state you're in. And then as well as your local or county level extension. Those folks are great at education and outreach. Our job is to get them material that they can provide, because especially a lot of folks in rural areas and small communities, they trust their extension folks, and they should. And so the more information we can provide them, the better off we are in getting that information out. And also, you should develop a relationship with the folks that map aquifers in your state, maintain the well logs, and collect groundwater quality information. You know, if you Google nitrate concentrations in Illinois, you'll find a few maps from probably the USGS, the Illinois State Water Survey, the Illinois State Geological Survey, maybe IEPA, and maybe a couple others. But find out who is doing that work, and they're folks you can lean on, because they want to help you, and they're a great resource, again, for geology, hydrology. You know, if a well owner calls us, one of our jobs here is to, if I bought 5 acres in Champaign County, I could call the water survey and say, well, I bought this property, it's at this location. I want to know how deep I need to drill, what my options are, and what the water quality is like. We have that information. We can look at all the surrounding well logs, tell them what's going on, that there might be 2 aquifers or might just be 1, because the shallower sand doesn't exist over the whole area. And we can tell them what the water quality is in some of those wells, because we've got over 30,000 water quality samples for Illinois from our lab that's collected over time. And so they're great to lean on, especially if a well owner calls you and they have a problem that you can't identify. The first thing to recommend is to have them test, but then see what's going on in the area and find out some background information on what the water quality is. So a little bit about the private well class. It's really, and I said this in the corner here, it's what can I do to help private well owners understand their wells or water better? Have them take our class. We've had well over 9,000 people take it since we put it out there. It's been vetted by many folks. I don't know how else to say that. It's self-paced. You sign up online. It sends you a PDF once a week for 10 weeks. And it's meant to be like kind of a basic course for a well owner to teach them how water gets in their well, what they need to do to take care of it, what common maintenance issues there might be, what they need to do in their surrounding area to protect their well, as well as if they have to add treatment, what considerations there are and what their options are. And so, yeah, and these webinars like today, we do one a month. Sometimes they're on specific topics or for specific group. I know we're doing one next month for realtors, and sometimes they're really just geared towards well owners themselves. But there's a lot of information on our website as well, and I'll talk more about that. This is our front page. If you go to privatewellclass.org, you can click on Take Our Free Class or learn by email, and it'll take you to the page, a page where you can sign up. For each of the 10 lessons, the first one's called The Science of Groundwater, the second one, Groundwater and Well Contamination, how it gets in your well and all that stuff. There's a set of resources that we've vetted and feel are the best of. Some of these, the figures in some of these documents we've actually used in the class lessons, and they're really meant to supplement what you learn by reading through the class lesson. The entire class is 86 pages currently. And so that's about 8.6 pages per lesson. There's also a lot of figures. There's a cover page and some of those things too. So it's not that much material, but it's enough to really get to the basics. You know, like in the Science of Groundwater, we explain porosity and permeability. Permeability is how water flows through an aquifer. Porosity is how much water is stored in an aquifer. Those are 2 basic concepts that a well owner should understand to know if they have a low flow well, why, or if they have more water than they know what to do with, why that's the case. But what that also means in the second case is that contaminants can also travel freely through an aquifer, and so it's more important to protect it from the surface. The entire class is available in Spanish. If you're in an area that has a lot of Spanish-speaking well owners or native Spanish-speaking well owners, this was developed by a young man. The translation was developed by a young man who was a PhD student here in civil engineering, who's from Colombia, and he was really frustrated being in the States with some of the translations that were done by automated machinery or whatever, how poorly they did. And so he not only did the class lessons, but also all the figures so that they're readable and in conversational Spanish. The goal of our program really is to help people understand why their well is important, why they need to understand how it works, and then, ultimately what they can do to help protect themselves and their family from risk. So that's really what our program is focused on, including all of these webinars. So I mentioned we do specific ones. We do one every year. We did one this last July. I just didn't update the slide on septic systems. We do it once a year. I bring in a septic expert from Massachusetts who's with RCAP, and we deliver basic information about how to take care of your septic tank and what the issues are. And then Jim, who helps us with this, answers questions that you all have when you come onto this webinar. He's truly the expert. I've not worked in septic systems per se, except what I've learned through doing this program. And it's great to bring in experts to do those things, which I did the same thing here. Dr. Kelsey Piper, who was at Virginia Tech and has done a lot of work with lead in homes with private wells. We had her speak about the research she did and what the issues are for private well owners. Lead is not a community water system issue. I mean, what you hear about is lead service lines and what communities need to do. That's because they're being required to under the Safe Drinking Water Act and under legislation from states. Private well owners can have just as much lead in their water because the lead's coming from premise plumbing, not from the water itself in the well. And so it really matters what the water quality is, whether your water is aggressive and corrosive and is leaching lead or copper, and those things you need to understand. And that's the same for anyone trying to give advice to a well owner. You need to know how old their home is, what kind of pipes they have, when their pipes were installed, to really understand if they even need to be worried about that. For lead and a few other topics, we actually have an extra a resource page, and you can find this by just going to Private Well Class/lead with links to resources to help folks find more information on their own, as well as from CDC and EPA and stuff. Lead's really a concern, especially in children, although there's no safe level for any of us. There's also a series that says 16, but now there's 21, I believe. We call them training videos. They're 4 to 6 minutes long. They're about one specific topic. This one, for instance, is what should I know about a shared well? If you share a well, we tell well owners, if you share a well with someone, do you have a contract? Is it in your deed? Is it on your property? If it's on the other person's property or somebody else's property, they may sell that, and the new owner, if they don't have any legal binding reason to, may decide they don't want to share their well anymore with anyone. And so there's a lot of issues related to that, a lot more than I realized when we started this. But one state, Washington State, actually regulates homes. It's either down to 2 or 3 homes on one well as a special class of public water supply, and so they're required to test and those sorts of things. And then probably our most popular video is either this one, why does my well keep losing pressure, or how does my pressure tank work? I think it's had over 400,000 hits since 2016. It's clear that a lot of folks on private water systems have pressure issues, and that there's not a lot of information out there to help them except commercially. And so we provide that information. And we started a podcast when we started our website. We did the first 3 of the 10 lessons. The other 3 articles listed here are from radio interviews we did for RFD Illinois, which is the Rural Farm Radio Network through Farm Bureau. But we haven't gone any further. They're actually an amazing amount of work to try to explain some of these topics without having any pictures. It's just that simple. And so it's a big hill to climb, and we haven't gone any further. But we have started a new podcast. It's called Tap Talk. It's really meant to look at drinking water in rural areas, whether that be small community or private wells. And so, this just started. So the one with Judy Manners, who's with the Tennessee Department of Health, came out last night or this morning, and it's about springs. She's done a lot of work looking at springs. It's really interesting, the work that they've done in Tennessee, because they have so many, and so many people swear by them. And then the one below that is Brian Swistock, who's with Penn State Extension. He's been involved in helping well owners in Pennsylvania for close to 30 years, or maybe over 30 years. And he has a vast amount of experience. And it was a great conversation we had with him about some of the things he's seen and some of the issues that are important to well owners. So I wanted to mention that just because this just started. There'll be 12 podcasts in our first season, so to speak, and then there'll be another season probably next spring. So as far as other things for environmental health professionals, NEHA has a version of our class on their e-learning website. You don't have to be a NEHA member to take it, but obviously if you want to get NEHA credit, I think you can even if you're not a member, if your state accepts it. So the bottom line is you can register on their website whether you're a NEHA member or not, and then you can take these classes for free, again, whether you're a member or not, and each one is worth 1 CE. There is a quiz at the end of each one you have to pass. And ASHE is the Home Inspectors Association. They also are able to use the NEHA website to take that class there and get credit for it through their association. RCAP hosts workshops around the country. You need to talk to the regional staff. If you're interested in setting one up in your area, they'd be glad to work with you. And if you contact us, we'll get you in touch with the right person. And also I mentioned this assessment tool. So we had 11 or 12 of us work together to develop an assessment tool. Brian Swistock was part of that group, by the way. And so it really is meant to be a one-on-one with a well owner. It's actually pretty detailed, and you really have to have some wherewithal to actually use it. It's got 18 sections, and it's available on our website, and as well as a tablet version is available on our website. As far as partner resources, really, we have a partner sign up, but it's really just for our newsletter. Our newsletter is really not for well owners, it's for professionals. We try to provide information that would benefit you as a professional in the work you do. And if you just go to under Resource Library to our partner resources page, you can sign up to get the newsletter. And all of those are online. You can take a look and see what kind of material we provide. They're really useful and they're really helpful. And then we also have other materials, which I'll talk about in a second. So, we were asked to help with a well sealing demonstration in Western Illinois. So we made a video, and this is how in Illinois it's required to seal a large diameter well. I don't know if you can see it here or not, but right next to the house where those bricks, they almost look like they're flat instead of a round circle. That's because the foundation started pushing out on this house. They didn't know they had this old well right next to their home. They're actually on city water, and in a town of about 20,000 people in Macomb, Illinois, and they've had public water since 1916. And so this well was just sitting here under a concrete slab. The person who lived there before didn't do anything with it, but there was a hole for the old hand pump, and the gentleman smoked, and when they found about, 10 lighters and thousands of cigarette butts that he'd thrown through that little hole in the concrete lid. And so this is now sealed. Gingrich Well Drilling, that's the gentleman there you see, helped us do that work. Yeah, it was a really neat day. A lot of sanitarians from the Western Illinois area were able to come over from their county health departments, and they got credit for it. Further down the page on each of this is from our latest newsletter. It talks about the webinar we did, a 4-hour one earlier this month. What's in the news? There's this really cool tool that someone developed called the River Runner Raindrop Tracing Tool. I encourage you to look that up. You can put a dot anywhere on a map, it'll trace the water to the ocean. And it shows you where your watersheds are and all those sorts of things. And then further down, there's more resources, a video, a podcast sometimes, all that sort of stuff. The assessments I mentioned, it's really meant to be done in the field at a well owner's home. It's a site assessment, a look at the well, geology, recommendations. This is just the first page, who the assessor is, who the participant is, how they use their water, what kind of pipes do they have, a lot of different things I won't go into today. You can take a look at it. But it's like a sanitary survey, if you're familiar with those for private wells, which sanitary surveys are for community water supplies. It's an opportunity to educate a well owner one-on-one about their situation, It gives you a chance to talk about best practices, like why they should sample every year for coliform and nitrate, and encourages them to communicate with their local resources and resource staff on, like why they can talk to their health department and get good advice and that sort of thing. RCAP's done about 2,800 of these already around the country, and they're requested usually by well owners or by a health agency. I know in Rhode Island, their health department's a fairly small staff, and for some of the problem wells, they don't have staff that can go out and actually do a field visit. So they've asked RCAP Solutions to actually do that for them, which they do. They also led a bunch of workshops. The 4-hour one I mentioned, this is several years ago, to train others to use this tool. And we're doing that work now through a 4-hour webinar, which sounds gruesome, but it's really not as bad as it sounds. So, but they're a great partner. They want to work with you. The new funding that's coming through EPA includes more money for sampling. So as they do these assessments, for many of them, they may be able to also collect a water sample, which is a huge advantage to helping a well owner understand what their situation is. I mentioned our online workshop. We just did one in September. We're probably going to do one more in December or January under our current funding, which ends March 31st. But then we'll do more next year as well, if you're interested in that tool. We do a conference. We've done one every other year in 17, 19, and 21. So we just did one in May. And those videos, one of the things we do, the first two are live or in person. This one was recorded or was online. But for the first two, we also had someone record those presentations so that those of you who don't have travel dollars can actually see the entire conference. So I encourage you to look at that. And I'll mention one of those presentations from 2017 later in the questions you all asked. Because we tried to make this not a research conference, but a practical conference. So the folks we brought in to give presentations were there to talk about issues like grout. That's what I'm going to talk about in a minute. Or treatment. How do you treat for nitrate or for arsenic? All those sorts of things that are practical that you can use and take back to your day job, so to speak. So again, we did one in 2017. It was in Champaign. We had about 125 people at both. It was 2.5 days. I mentioned Barb Lukanen, some of the data from her work I showed earlier on why well owners don't test, but she gave us a 30-minute presentation on their study. There she's ironing $2 bills so they'll fit in the envelopes better, which I thought was funny. Anyway, and they're all available on YouTube. And again, we did one in Harrisburg, Pennsylvania in 2019. Todd Giddings is a hydrologist in Pennsylvania. They're one of the groups, he's with one of the groups that helped create a local private well ordinance since the state doesn't have rules. And so he was our first speaker at that conference. I want to mention this brochure. So if you work with well owners, we developed this trifold brochure. It just is your well water safe. And then when you look at the inside, it says, why you should get your well tested. These are some basic things you need to do as best practices. And then if you really want to learn how your well works and how to solve problems, take our class. And so there's a spot here that in the yellow circle that we left blank. That's because when we offer this to groups or to health departments or labs or whoever, we expect you to put a label on this with your information. We're trying to share it. It's not about getting them to us per se or just alone. It's about helping you reach out to tell them about this class and also get them to understand that you're involved and a resource for them. And so we left that blank on purpose. We print it, we ship it, we provide it completely for free. And there's also a version in Spanish as well. And so this is from our newsletter that just came out on September 1st or 2nd. We're getting ready to do a 4th printing. And so if you're interested in any of those brochures, I encourage you to go look on our website. You can download the PDF. That's not the same because it doesn't fold. When you print something from a PDF, it has edges. These are actually printed by a printer, and it's a trifold that comes already folded and ready to hand out once you put your labels on it. But I encourage you to go look at our September newsletter on our webpage and click on the request brochures button if you're interested in those. Again, we've already given out over 80,000 from their first 3 printings. And so we've got a lot of partners around the country. That's about 400 organizations or more. Some have asked for them more than once. I know at least one state lab puts them in every lab result they send out to the well owners who use them. So it's really a useful, free thing you can have and use to reach out to well owners. So the rest of the time we're going to spend working on questions. We had over 400 people register, and so there were a lot of questions, but we'll get to a lot of them. Our program is nationwide, so I try to, just like one of the questions was about what we recommend testing for. There's a caveat to that because in some areas you have different problems. But in general, for a national audience, we have a list of things we would recommend you test for. And so if you ask a state-specific question, I generally don't answer those on this, but you can send us an email and I'll work with you. And if you have a question that we don't get to or something that I've said already today that comes up, you're free to put it in the question box or the chat box on the GoToWebinar window, and Katie's adding them to this Google Doc, which I can see on my other screen. Looks like there's 2 questions so far, and I'll just slide that over in front of this at the end, and we'll work on those. And the only other caveat there is it may be a question I can't answer, and I'm not going to try to answer it if I can't, but I will ask you to email us, and I will find an answer, and using the resources I have and the folks that I know, find someone who may be able to help. So my old well has not been used since Katrina. What steps should I take before uncapping? Well, if your water lines haven't been, they've been stagnant and they haven't been pressurized, they're likely to have bacteria growing in them, and that's a problem. If it's been a very long time, it could be biofilms or layers of those, which may be difficult to get out, or it may take several times. But not only should you flush your lines until the water's clear and then test it, but I would also shock chlorinate it prior to doing that. So because there's no way, if the system's been down like that or it hasn't been used and water hasn't been moving, even in your well, there's likely to be things that have took hold and grown. So I would shock chlorinate the system and your well, which these directions tell you how to do both at the same. You do it all at the same time. Flush all the lines. I'd flush it first, then chlorinate, and then I'd sample. And I would not use the water until you've sampled and shown that there is no issue. So there's, every agency has descriptions on how to shock chlorinate your well. Some are really good, some are really poor. I know I mentioned Dr. Kelsey Piper. She did a study with one of her PhD students at Virginia Tech on looking at all the state guidance and found some were really good and some were poor as well. But I went through about 50 of those, and I picked the one from Minnesota Department of Health, the one that's shown here on top, as what I felt like was the most complete guide. There are extenuating circumstances sometimes where shock chlorination won't work. And if you end up in one of those situations, contact us. There's oddities, like chlorine doesn't work at a pH above 8. Sometimes there's layers and layers of things and you just can't get rid of it. Or you may have a source. That's not the case for this question, but you could have a source like your septic or a feedlot or your enkarst where you're always going to have bacteria hits because the aquifer itself just isn't safe. And in those cases, you'd have to add continuous disinfection. But we recommend shock chlorinating using this approach. As you go through this, it tells you how to mix it. It's got diagrams. There's a reason why you don't pour straight bleach down a well. It's too strong. It can leach metals from your brass fittings on your pump or from your casing or your drop pipe. It needs to be mixed at a certain concentration. Even talks about what to do if you have treatment equipment. So it's really a well-done document. And you can get to that. I forgot to show that here. I showed those resources for lessons 1 and 2. If you go to the class resources pages, look under lesson 10, and you'll see this document listed, and that's what I would use. So there was a bunch of questions this time, which were new, really. We typically don't get these about, drilling, digging equipment and types of wells dug by each, about seals and caps and annular space. I don't drill. I've drilled a lot of monitoring wells. We use PVC. I haven't actually put in water wells for homeowners. And so some of this stuff isn't something I have a lot of expertise at, but I do have folks I can lean on. And so, and the same with pumps. I mentioned the Midwest Plan Service document 14. I know that has a great listing of all the different types of pumps in it. There is a cost to that. It's out of Iowa State, but it's made up of all the ag engineering departments from a number of the land grant universities in the upper Midwest, and they went together and put this document together. It's really useful. So what I can say here is we do a groundwater and wells class, but it's mostly focused on groundwater, like what porosity and permeability are, and just the basic well types that we went through today, maybe in a little more detail. So we'll have to develop something that's more along the lines of what these questions are asking, to take you from drilling the well to the home plumbing and check valves and backflow devices and all those things. But we will, and it will probably be early next year before we have that available. But it's something that's been missing from our program, and it's just going to take a little effort to put that together. That's the best I can give you today. And feel free to email me about that, prod me if you will, and we'll make sure we get that done. How often should a private well be tested? What contaminants should be analyzed? And what level of the contaminant should require concern or treatment? So the third part first, the EPA through the Safe Drinking Water Act requires all public and community water supplies to test, right? Every community has to sample every 3 months. If they don't meet the standard, which is the MCL, that's been approved through the EPA process, like arsenic, it's 10. It used to be 50 until 2006, and they revised the rule. So now every public water supply has to have arsenic below 10 that they deliver to their customers or that they're providing as drinking water. Those don't apply to private wells at all. But in general, what every health professional and every groundwater person, anyone in the private well industry really uses those MCLs as a guide, and that's what's considered safe. So what I would use is you can even just look at EPA's webpage. They list all the contaminants and all the constituents that they regulate. There's both primary and secondary MCLs. Primary means they have a health effect. Secondary means they're aesthetic, taste, odor, staining, those sorts of things. And so, but I would use those when you're working with well owners as far as looking at what levels they might be to decide if a well is safe or not, or if the water's safe or not. And, I just ran into someone who was taking samples from their outside spigot only, and I recommended that they don't do that anymore. If they're only going to collect one sample and send it to a lab, it should be from their drinking water tap in their home, because you want to know what your drinking water is first for public health protection. The source water side of that is great knowledge, but especially an outside spigot, they're not used every day. If they're not properly, if they're not constructed in the right way, they could have bacteria issues, especially in the backflow prevention, or there's a bleeder in there for freezing so they don't freeze. Those could harbor bacteria, and so you should be sampling from a drinking water tap. So what do we recommend? Again, annually for coliform and nitrate. So coliform bacteria isn't necessarily harmful to you, but it's an indicator. Same with nitrate. Nitrate is regulated because of babies and blue baby syndrome. But they don't regulate it yet for anything for harming adults or others that are more than, I think it's 9 months old. And that's until our stomachs develop enough acidity to break down the nitrite that forms, that causes blue baby syndrome. So coliform and nitrate are indicators because they're ubiquitous in the shallow environment everywhere. And they should not be in your well. Coliform bacteria should not be in your well at all. Nitrate should not be in your well at an elevated level. And so it's a simple thing to test for to prove that your well casing is sound and your well cap is sound and sealed, and that your aquifer is not contaminated, because those are the things you'll find first if there's a way into your well or if there's a way into the shallow aquifer from the surface. And so you should test for those annually. They make sure that your well's safe as far as the integrity of the well. And then we recommend the rest of these things one every 3 to 5 years, because they give you an idea, especially if you have zinc and cadmium, if you have galvanized piping is a good example. If your water's not corrosive, it's not going to leach things. The opposite side of corrosive problems with water is scale forming. there's a lot of work done to make water not scale forming because it scales up pipes and can eventually plug them. But on the opposite end of that, if you have too much corrosiveness or aggressive water, then you start leaching the actual metal, and that's where we run into problems with lead, copper, and those things. And so that's our generic list, if you will, and they give you a good sense of what your water quality is, but it's also situational and based on where you're at. And so I'll give you a few examples of that. In Massachusetts, they know they have a lot of uranium and arsenic. So the Mass DEP has actually created a web page where you can enter your address. And if you have a bedrock well, it'll tell you whether you're at risk of one or both of those things. And so, we wouldn't recommend everyone test for uranium. But if you're in Massachusetts on a bedrock well, you should look into it because it may be an issue just because it exists in the rock there. This is Rhode Island. This is my favorite example because the small little dots everywhere are where there used to be orchards where they used a lot of arsenic, and now there's a lot of arsenic in the soil, and in some places that's leached into the groundwater. But the big splotch in the middle is where they have high beryllium. And when I found this on Rhode Island Department of Health's website, this is probably 8 or 9 years ago, I had no idea beryllium was a regulated contaminant. I'd never heard of it being elevated anywhere or even an issue, but it is here. And so this is a great example of why you need to look at your local resources and your state resources first to determine if there's any other issues. And even beyond that, I recommend you call your state health department and your state resource agency that does water quality work and ask if they know of any water quality issues in your state that affect groundwater. If someone called me, I'd tell them that, yeah, we have, a lot of radium in some places and we have arsenic in some of our aquifers, and here's where you need to be concerned about that. So it's the same thing. You need to do your due diligence and help a well owner understand that there may be other issues. Now, in all likelihood, if you're with a local health department and you have arsenic in your area, you already know it, and that's true. But it's always good to follow up and become better informed, and that's kind of my point, I guess. There's more and more of these kind of sites that are now becoming available. Wisconsin DNR had Stevens Point, University of Wisconsin Stevens Point developed this online tool, GIS tool. This is a dated image, but it's still there, and it's changed some because they've got more samples. But this is a great example because I told it to look for arsenic by county, and it's showing me all their water quality analysis for private wells. A few of the counties are clear because they have no data. But the 3 red ones by Green Bay indicate that the average water quality sample in those 3 counties has arsenic of over 21 ppb, which the standard is 10. So I'm moving to that area, or I'm going to buy a house in that area. This is a great resource if I'm in Wisconsin and want to know if I should be concerned about sampling a private well. And again, the more data that comes along, this image is probably 4 or 5 years old, the better this has gotten. And I don't believe there are any more clear quote counties anymore. They've got data from every county. So, because nitrate's a big issue up there and a few other things. I'm curious to know what local resources are available for improving wells, i.e. Partners. So well owners many times don't understand that there are folks like you nearby to help them. So we developed a lesson 7, that's really just about finding local help. I mean, it even walks through, like if you want to find your well log, Google my state water well log. And the example I use in the lesson is Missouri. So Missouri DNR, which houses the state's well logs in Missouri, is the first link that comes up on Google. So it's really about teaching them that there are resources out there, that you need to be inquisitive. You need to find out who the players are in your state or local area that you can lean on. And so as you as a professional, you can put that outreach out there, but you can also work with other partners. So like if you're with the health department, you should know who your extension person is, and maybe the person at the State Geological Survey or your water quality agency. Also, I'd contact your regional RCAP affiliate and develop a partnership with them. They can provide a lot of resources. So EPA provides a lot of funding to RCAP and us to assist people with well issues. And that's not just well owners, but also the professionals that work with them. So they can assist you in developing workshops. They can do well assessments for problem wells if you don't have the capacity. Even provide sampling, as I mentioned earlier. Also work with you to look for other opportunities for resources. I know there's at least one project going on that we're aware of that involves RCAP, and they're using the assessment tool and sampling with state funds to do additional work looking at other constituents in their area. And so, CDC offers funding to either state health departments or county or local health departments for private well work. And I don't know a lot about that, but we can probably get you that information. I can't remember what the program's called. But there's a number of states and a few counties around the country that get funding from CDC to develop more information or to sample or develop a database or to modernize the information they have, just meant to encourage and improve private well knowledge in that area. And so RCAP would be glad to work with you on those. And they could also just provide expertise. If you're going to hold a workshop, they can be a speaker. They can come in and talk about their program, what they know about wells in your area. If they're in your region, if their regional affiliate is in your state, then they've done well assessments in your state. I guarantee it. And so they've got some information and understand some of the issues related to wells in your area. Are well water sample tests results required for real estate closing or from a mortgage company in Illinois? Now, I realize this is a state question, but it gave me an opportunity to talk about a lot of other things. So in Illinois, I already mentioned there is no required water testing, but the seller has to say whether they know there's anything wrong with the well or septic. And so that's the only rule that I know of. But these days, it's mostly the mortgage companies or FHA or whoever that requires testing because they're trying to protect their investment. But what we tell well owners and people who are going to buy homes with wells, because we get asked that question a lot, I'm getting ready to buy a home with a well, what should I do? It's buyer beware. You should test before you buy a home. I had a person call me from out east who said, well, if I don't make an offer today, we're not going to get the home. I said, that's your decision. But I'd require a water quality test, or you may be putting in treatment and having to deal with that for the length of time you live there. And maybe you don't think that's a big deal, but I'd rather know before I bought a home because you're going to have to add treatment once you sample, because otherwise it'll lower the value of your property unless you've remediated the situation. So we do a webinar for realtors to explain those issues and why we try to encourage realtors, whether you're representing the buyer or the seller, that it's important to do a test well beforehand and also remediate any problems beforehand. It'll make, it's the right way to go, and it's on the up and up, and it probably will increase the value of their home rather than lower it. So there are 4 states, at least 4, and there's probably more, that require sampling with a transaction of a property that has a well. And Rhode Island is the only one that actually included it in their building inspection code so that a building inspector can use a water quality result to condemn a property if it's bad enough and they're worried about people not remediating it. So they can require remediation if the test result indicates a health risk. But the other states, like New Jersey's the state that did it first. They've almost 20 years ago. And the state lab collects the sample and only provides the results to the buyer and the seller, and it's up to them to work it out. They don't share the data online. They share it at a scale that you can't tell in any individual home or well to protect property values. But at the same time, they know where areas are higher in certain constituents. And the last thing here, there are a number of states that have considered these over the years and are, again, with more information available now on private wells and more research being done, we expect the number of states that have at least that requirement to grow, and there's a number that are contemplating that right now. I said I'm using this for an example. I want to mention that, with HUD loans, which is FHA loans through USDA, VA loans through the Veterans Administration, and loans through HUD themselves, first-time home buyer, they have this huge manual that basically says the mortgagee, if they want one of their loans, has to try to make a connection to a public or community water system first, if it's feasible. And if that isn't, if that's prohibitive or not reasonable, then they can use an existing on-site system, which would, could mean a septic, or excuse me, a cistern, a spring, a well, a lot of things. But assuming it's functioning property, blah, blah. So in other words, they're saying that if you have the opportunity, they want you to connect to a community water supply first. And they say you have to, and that's, again, to protect their investment in the loan that they're giving you. So what it says here in this document, which you can Google HUD 4000.1 and get to it, I warn you, it's over 1,000 pages. It's not just about, it's every rule related to a HUD loan. When an individual water supply system is present, the mortgagee must ensure the water quality meets the requirements of the health authority with jurisdiction. That means local or state. If there are no local or state water quality standards, then water quality must meet the standards set by the EPA as presented in the National, that's the Safe Drinking Water Act that I mentioned. So no one does that last thing. No one requires everyone to test for all the primary drinking water contaminants. It would cost, $2,000 or $3,000 at least. But there are many local or states that don't have rules, and so it's a hodgepodge of what really happens. Some do nothing. Some just test for coliform. Some may test for coliform nitrate and lead, or a few other things. But there's a disparate rule here that isn't equal for everyone. And one of the issues I have with private wells, it should be either we regulate them all or we don't regulate any of them. If we're going to have a regulation, there should be equal health protection under the law for everyone, like we do for the Safe Drinking Water Act and public water supplies. And so I bring this up partly because there was a group that was writing reference letters for mortgage companies on what they needed to test for. And they were using this document. This was a PDF. And when I tried to get a copy of it from them, they couldn't even tell me where they got it from. I found it on a mortgage company's website in Michigan. And this was a rule from 1994. That was HUD's rule back then. It was superseded by the current regulations in 2001. So since 2001, this has not been true. And yet it's still being used as evidence that they're meeting the water quality parameters established by HUD. And there's no one checking. And so it's really a concern because this isn't everything. One thing that's not in here is arsenic. And I had a homeowner in Illinois contact me and chewed me out because she bought her house. They tested not for arsenic, but for whatever else they did. It came back fine, so they were told their water is safe. She has 3 kids. 5 years later, she decided to test because she read something in the paper about high arsenic in their area, and she had arsenic at 150 ppb that they'd been drinking the entire time. And she blames the state. Why isn't the state doing more to protect me? And it goes back to it's all local jurisdictions and local, it depends on who's active and who isn't. And this is a great example of that. And so I point this out every chance I get because it's important to understand what the rules are and to make well owners informed on they should do more than this for testing. So what's the purpose of ventilation and wellheads? So the vent on a well cap is there to equalize pressure, plain and simple. When you pump a well and it starts lowering the water level, if that were completely sealed airtight, it would cause a vacuum. And if most wells eventually are not completely sealed airtight, either the gasket goes bad or it depends on the type of well cap, but it can cause a vacuum that will force air in or other things into the casing. So the vent is there so that the system stays at atmospheric water pressure at the water where the water level is. Otherwise, it'd be like sucking a straw when you get the other end plugged. It could even, if it got strong enough, it could even crack like PVC pipe. And so, yeah, that's the purpose. What do I do if the well log is not available to be located? So the best source is the driller. If the well owner knows who the driller is, or anecdotally, even a neighbor or somebody else knows who the driller was, or if there was a contractor that worked on it, replaced the pump or lowered the pump, that's probably your best bet. Next is the agency that requires logs. They may have it or they may not. I did a study in a rural area in Illinois in 9 townships. So it was 36 times 9 square miles. And we found 1,700 wells, and only about 800 of those had logs in our files. So less than half. And we're a state that's has more wells logs per well than most. So if there isn't one with your state agency or your local agency that maybe keeps them, then what I would suggest is then look at other wells in the area. It's possible there's only one aquifer, and it's all the wells are fairly consistent in depth. If that's the case, it gives you some confidence that this well is probably similar. And I've had to do that a few times. Obviously, you don't like to, but if it's an older well, then it's only a 4-inch casing. That's likely not a bored well. And so if all the other wells are all around 120 feet deep, it's likely that one is as well. And that's not a great advice, but you can use the other well logs for information on water level, certainly, and where they're getting their water from. I mean, the bottom line is one of the most important things for a well owner to understand is where their water comes from. If it's a bedrock well versus a sand and gravel well, how deep their pump set, and how deep their well is. We have people who say, well, my well, I ran out of water. Well, it turns out it's because they only had the pump 20 feet into water, but there's another 120 feet of well there. So all you had to, it's much cheaper to have a contractor come out and lower your pump another 40 feet than it is to install a new well because you think your well's dry. And so, that's the best you can do. And unfortunately, probably more than half the time, you're not going to find a log. And that's just the reality of how this has evolved over the years, state by state. What is the suggested method for using bentonite chips for the 20-foot sanitary seal? Should water be added in sequential steps, or can they be left to hydrate naturally? So the short answer is they can be left to hydrate naturally. And I don't know if some state may have a law that requires you to add water intermittently, so I put that in there. But they'll get water out of the soil geologic material where they're at, and they'll self-seal. I mentioned we've done a lot of monitoring wells. We use bentonite, natural bentonite chips. It turns out in the Nebraska Department of Health and Human Services, I think that's the right name for their agency, they did a grout study back, it was from 2001 to 2006. And what they found, and they used clear pipe so they could camera it and see what happened. And what they found is a lot, in some cases, the slurry, the liquid grout, did not stay in the annulus. It went out into the formation. So they published several papers and research studies about it. And it's the biggest thing that happened from that to me is that no state that I know of changed their regulations because of that, even though they showed with complete proof that grout slurry sometimes will not stay in the annulus, and so the well may not be as protected as people think. And what I suggest you do on that, we had a gentleman from Nebraska come to our 2017 conference and talk about the grout study, and so you can find that on our webpage under the 2017 private well conference. And if you also Google Nebraska grout study, you'll find all their information about it. I know I talked to someone from one of the Southwest states, it might have been New Mexico, who said that they were working on developing regs around that. They hadn't done it yet, and that was last year. And so there may be another state who actually develops rules because of this. But in all honesty, every state should look at this and consider developing rules around it. And bentonite chips are what they found to be the most stable, the best way to grout a well in every case. Is there an EPA website for approved home treatment systems? So the EPA does not approve treatment. Treatment systems go through third-party certification, and those are National Sanitation Foundation, Underwriters Lab, and the Water Quality Association, their Gold Seal program. And so especially for home treatment, you would want to make sure that any treatment you get for removing a certain constituent either has the NSF standard seal, UL seal, or WQA seal. That means it's been tested to remove that constituent to a certain level, and it's shown that it can do that under varying source conditions. And so we do talk about that in our lesson 10. And when you look online at treatment equipment, you might find 50 treatment devices for arsenic removal. If you sort it by cost, there's going to be a bunch at the top that are maybe $100 or $200, and some down at the bottom that are going up to upwards of $1,000. When you start looking at those, you'll find that the ones that are $100 or $200 have not been through any kind of third-party certification. And so it's really, it should make you wonder why that company didn't go to the trouble of proving that their system works. And I personally would not buy any equipment that hadn't been certified by one of those groups. As far as other information, the WQA does have a lot of information on their website, and the Water Quality Association, and you can look at different types of treatment equipment there, find a lot of the manuals for how to operate them and maintain them and stuff like that. Also, the EPA does have a drinking water treatability database that's active, and it lists a lot of, I think there are like 135 different treatment options in there. But that's really geared towards water utilities and and first responders and for spills and things like that, not for home treatment. We also had the Association of Public Health Labs and WQA participate in a webinar in February of 2020. So if you go on our website and go back to our February 2020 webinar, it's just on sampling, testing, and treatment. So it provides more information in detail. And I recommend you check that out. How big of a, okay, so I left this in from the last time because this is becoming a bigger issue, and manganese is so common in groundwater. We find a lot of it in Illinois. It's been on the secondary list for a long time, and it's currently on the UCMR, which is the, I call it the candidate contaminant list, but I can't remember what UCMR stands for. Somebody will probably tell me. But anyway, that's before EPA decides to regulate a contaminant, they put it on the UCMR list, and they have a certain number of communities actually test for it and determine how much of it there is out there. And what we've learned and what research has shown over the last 10 years or so is that manganese is really a health risk. It causes neurological and behavioral effects, deficits in memory, attention, and motor skills, especially in children. So there are a few states that already regulate it, and Canada regulates it. And I put the wrong, I mixed something up here. I put PFAS on there. I apologize. Yeah, the example I want to share at the bottom is a well owner who lives in the country has a 3-year-old, and they had 49 milligrams per liter. So I reached out to several experts, and they all said, shot back an email right away and said, tell them do not drink that. And so even though it's not regulated per se nationally, you need to be concerned about your well owners if there's a lot of manganese in your water, and there is a lot of groundwater, especially in Illinois, because it does have health risk, and you need to, luckily it comes out the same way iron does, and so you can precipitate it out. You can get an iron filter, or you can add, you can add an oxidant to remove it, and so there are ways to get rid of it, but it's certainly important, and I just wanted to mention that. PFAS. Somehow I got PFAS on that last slide, and I apologize. New regulations concerning PFAS or PFOS. Well, then they're generally called PFAS chemicals or PFAS compounds, and that's a list of 200 and some odd different ones. Some have different health effects. Some have different ways to treat them. It's really an evolving entity. So the EPA has the most information available on PFAS. There are not regulations at the federal level, and those are still years away because of the way the process works. But eventually there will be at least some PFAS regulations. In the meantime, some states have passed their own standards already. So several out east have. And the EPA has issued a health advisory, which is not binding, it's not a regulation, but it's really the guidance they're trying to provide in lieu of having a rule in place, which again will take a long time. They're still even working out some of the detection methods on how to determine if there's any of those chemicals in water. And so I recommend your best places to go to epa.gov/PFAS. And one of the lists on that page is to state resources. Not every state has resources, but a number do of things that they've done, and some are ahead of the game compared to others. I know, like I was on a call this morning with a water quality group, and they mentioned that Michigan has a really robust PFAS testing program, and they actually put on a PFAS conference now. And I think that was started last year, but it's online and it's a week long, and it's really a useful, this gentleman said it was a really useful conference. So I know I let our staff know already about that being available this December. What kind of I apologize. This is from the last time, and I thought I took it out, and that's my last slide. So I know I've gone long. We do have some questions. I'm going to quickly go over to those. Let me bring that up here. Just give me a second. And I'm going to make this larger. All right. What climate conditions or processes affect wells? You know, it's not that it affects the well, it affects the aquifer generally. So we've had more extreme events lately. So extreme drought, California starting in 2010 or so. They've had to lower wells that were 300 or 400 feet deep, now are 500 or 600 feet deep in some places. It's caused quite a problem there for private well owners because a lot of wells are gone dry. On the other hand, especially in the South, there's been a lot more flooding over the last 5 or 6 years, and whether those stream events are because of whatever process, or it's just the trend these days. Whenever a well's overtopped with water, bacteria and surface water can get into them. There's a whole process in place for what you should do if your well's been flooded. So as far as other climate conditions and processes that affect wells, earthquakes can affect wells. We had a well in Southern Illinois 15 years ago. There was a pretty small earthquake by many standards, but in Missouri, and one of our wells in Southern Illinois, the water level dropped 4 feet. And we attribute that to changes in where all the fractures are and connections between fractures in the rock from that earthquake. So it can affect things. It's not common on as far as like an earthquake, but we're seeing the Illinois River, for instance. One of our staff recently said that they're wondering if the Illinois River contributes more to the aquifer in Mason County, which is a sand and gravel aquifer, because since the 40s or 50s, the typical water level in the Illinois River has been higher. We don't see a huge difference in the amount of rainfall, but we do see a difference in the highs and lows of the Illinois River, which is very large. And so there are long-term effects, if they are, other than those short-term events, especially a flooding event would be the biggest one, I think. What's the best way to approach a customer's question about high chlorine levels in their well? She blames it on road salt, but I'm saying that the surface water contamination could be an issue. Unfortunately, she has been influenced by someone trying to sell a whole house system. Yeah, that's unfortunate, because that's some of the advice we give well owners, certainly, is, when people say, well, I had my water tested, well, who tested it? Well, it was a treatment salesman. I always recommend you should get it done at a certified lab, those things. We see, especially in urban areas, like in the Chicago area, we've seen a huge increase in chloride in the shallow sand and gravel aquifers up there because of road salt. I don't know if you remember, but probably 25 years ago, most road salt that the Department of Transportation had at their stations or community had were out on the ground. And that's no longer the case anywhere. They're all in buildings, they're all protected. It's because road salt really has become an issue, especially in areas where it's used a lot. And I don't know, and you're saying, but I'm saying that surface water contamination could be an issue. And I guess I need to know more about the situation there. Is she near a river or a lake? Because the surface water, we do see higher chlorides in like some of the rivers in the Chicago area, but that's all because of road salt. It's caused a chemistry change in many of the rivers that are in the urban areas up there, and that's unfortunate. And so, it also depends on her well. If her well is 300 foot deep and there's a 100-foot clay layer at the top and it's well grouted, properly sealed, all those things, then it's very unlikely that it's coming from a surface contaminant source. There is natural groundwater that's high in chlorine. Even I mentioned the Mudhammad Aquifer earlier. There's an area on one wall, if you will, of the Mudhammad where we see chlorides in the 500s, and the taste threshold's about 250, and it's because of bedrock water that's actually salt water, seawater, that is upwelling into the Mudhammad slowly because the water levels have dropped in the Mudhammad, and so it's caused a gradient flow. And so there's areas out there where they have to treat their water to drink it because it just tastes salty. And so it could be either of those things, depending on her situation. And if you send us a well log and some information about the geology, we could certainly take a look. Or you could talk to your state geological survey as well, and they may have an idea. Ohio State University used to have a chart where you could put up the contaminant in. Put a contaminant in and its amount, and it would tell you what to do. Is there another place to go? So Katie put up the Be Well Informed tool. If you Google New Hampshire Be Well Informed tool, I didn't have time to mention that today, but it's a really great resource. They use funding from CDC to develop a tool where you put in the amount and which contaminant, and it'll tell you if it's over an MCL, and then also recommend the types of treatment that would likely remove that contaminant. It's better than any of the previous ones that we've come across because, for one thing, it asks you, it has a drop down for the units, and many of the other ones, the older ones that have been around that are like you're talking about, they tell you have to convert the units to milligrams per liter. And for some folks, well, for a lot of folks, that's difficult. And as an example of that, one of the questions on the pretest for our class is to convert from, I think it's milligrams per liter to ppb, and only 27% get the question right, and it's an answer A, B, C, or D. And so converting units is a tough thing. So this one allows you to, if your lab puts some units in milligrams per liter and some in other units, maybe it's, whatever it might be, this gives you options to match what's on your sample result report. And the other advantage is it also provides treatment options because, literally we've had well owners who've only had some kind of dip test done on their house, and they put in $1,000 worth of treatment based on that, not understanding that it would have been better to spend $200 on a high quality water test for all the constituents of concern, and then have someone give them an informed, unbiased opinion on what to test for. So the other thing I'll say about the Be Well Informed tool, when you go on there, it asks you what city you're in New Hampshire. There is an option for anonymous, and they realize that we provide that link to people all over the country. In fact, we had them come talk at our 2017 conference too, and so you can watch a 30-minute video on one of the developers in New Hampshire Department of Environmental Services talk about that program and what they do in New Hampshire. It's really useful for everybody. That's just the bottom line. I saw a quote, private wells are not a community water supply on a previous slide, and also that private wells are not protected by the Safe Drinking Water Act. What about food establishments which are on well water rather than city water? Are those protected by the Safe Drinking Water Act? Well, they have to meet the criteria for a non-community water supply. That means that they provide water for at least 180 days to at least 25 different people. And so most food establishments are. And your state should have a non-community program. It's either part of their community program through the same agency, or in some states it's a different agency. I know in Illinois, our state EPA office does community water supplies, and they've delegated that authority to the Illinois Department of Public Health for the non-community side. And so non-community water supplies are food establishments, factories, rest areas, and they fit into two classes, transient and non-transient. So a non-transient means it's the same people drinking that water, I think at least 60 days. So it'd be like a school or a factory, versus a transient where it's different people every day, but it's at least, I think, 180 days. You'd have to look at the rule to be sure. I don't deal with them that much. But that's like a rest area or a gas station or, a food establishment out in the country or wherever. And so, yes, they are. And yeah, the rules aren't quite as strict for non-community water supplies, or they used to not be. But I would look that up in your state and talk to your state resource agency, that your state primacy agency that has the authority to take care of those, because they should all be sampled. Yeah. So if this is the case, if you have conducted the yearly water quality, could those act as a history that could be in your favor as a seller? I would say definitely yes. You know, if I go to 2 homes and one has never been tested and the guy's like, oh, the water tastes fine, and the other one's like, well, we test every year. Here's what we test every year for coliform nitrate, and we've tested, you know, we tested 4 years ago for the suite of things and all came back fine. You know, that gives you a lot more confidence, because some people see all these stories about private wells being bad and assume every well's bad, and it's definitely not the case. You know, many private wells are just fine in their water quality. They may have too high of iron, and so you have rust stains, or, you know, some other cosmetic thing, but they don't have real water quality issues. But you don't know unless you test. And on the third side of that, if you test and do find something and you add treatment, that also shows the potential buyer that you're proactive, you care about your water quality, that you've already created. And that's actually the advice we give to realtors. We're like, you should, if you represent the seller, get your water tested, because if you have a problem, you need to remedy it before you try to put it on the market, so that you can show that you actually, that the water's safe to drink. Because otherwise, if this potential buyer tests the water and finds something wrong, they're going to walk away. You know, how do you not know that you've been drinking water that's high in arsenic all these years? You know, it's just, I mean, it's common sense. And I think it's going to start leaning more and more and more that way, as private wells become more on the forefront of water quality issues. So the EPA just did a study. I would say a study. They did some research where they were trying to determine a way to estimate the number of private wells in the country. So on their website, until, it still might be there, but soon it's going to go away, it says there's only 13 million private wells in the country. I know there's a lot more than that. I think the USGS estimates 18 million. And with all the state people I work with, and all the states that have over 2 million private wells, I think that number's a lot higher. And I've said that for years. I just don't have any proof. Well, now there's the work that they've done using the 1990 census, which is the last time that that question was asked. They've been able to estimate based on home sales and data, and a number of other factors. But they're going to come out with an estimate now of 23 million private wells in the country, and I think that's much more accurate. I know in Illinois it was assumed around 500,000, and I've always felt like there's 800. Their estimate's 750. And so it's just becoming a bigger issue. More people want to be off their grid or want to live out and away from urban areas. You're seeing, you know, in Maine, for instance, they put in, there's now more private wells. There's more people on a private well in Maine than there are on community water supplies. And so I think that's a trend, and it's going to continue. So I certainly recommend being proactive. All right. Thank you very much for your time. That's the last question. Again, here's the information. If you email us, we can get you the information you need. If you have any further questions, you can email us here. I think in about an hour or two, you're going to get an email saying thank you for attending, and it's got my email address. You're also welcome to email me. Yeah, if you have any other questions that come up, let us know. All right, thank you, everybody.